And welcome everyone to our BPH webinar through MidLantic Urology Solaris in conjunction with Boston Scientific. I appreciate you taking the time tonight to spend about an hour with me while we do a tour of prostate management and health. We'll go through some questions at the end of the presentation, and we have a lot to cover, so we'll dive right in here. Okay. All right, so just a quick acknowledgement here. No need to take any photographs, audio recordings of any type during this presentation. The recording of this will be shared with you afterwards as well, so you can rewatch it or share from that standpoint. So again, I'm Dr. Dean Laganosky. I'm a board-certified urologist in Philadelphia, Pennsylvania. I specialize in complex voiding dysfunction, minimally invasive surgical options for not only voiding, but urologic oncology, as well as men's health. We're going to go over a comprehensive overview today of not only prostate anatomy and health considerations, but then what is BPH or benign prostatic hyperplasia, as well as different treatment options in detail. So we'll start off with an anatomic overview of the prostate gland. So what is the prostate? Essentially, the prostate is a walnut-sized organ that sits at the base of the male bladder. It surrounds the tube or the urethra, similar to a ball or a ring. And its primary responsibility is to really help to support the sperm for fertility purposes during ejaculation. It's actually responsible for majority of the prostate seminal fluid, along with the seminal vesicles that sit behind it. And the prostate grows with us throughout our lifetime, typically reaching normal adult size in our early 20s. And then starting around the age of 40, we start to get even further growth over time, which can start to cause voiding issues and some other related problems, which we'll get into in a bit. So what can happen to the prostate? Well, there's several different things that can affect the prostate gland, different conditions. So what we're going to really be focusing on tonight is the benign enlargement of the prostate gland, or BPH. This is normal, non-cancerous growth of the prostate that can contribute to voiding issues. Other conditions that can also mimic BPH or have similar symptoms is inflammation in the prostate gland, which is termed prostatitis, and prostate cancer, which is a malignant growth of the prostate, a different process than BPH. We'll start out with an overview of what an enlarged prostate is, and then we'll go into some of the symptoms related to this. So BPH, or benign prostatic hyperplasia, is a term for an enlarged prostate. Typically, a prostate is about 1.5 inches in diameter, roughly the size of a walnut. As that prostate gland grows over time, it can compress along the tube that leads out from the bladder and create an issue with evacuating the urine, contributing to symptoms of urinary frequency, urgency, and other related symptoms. BPH, is very important to note, does not mean that you have prostate cancer. So it is a benign, not a cancerous process. It does not cause prostate cancer. Symptoms of BPH, which are typically obstruction of the urination, can be similar to symptoms associated with prostate cancer or swelling of the prostate with prostatitis. And so it's very important that if you're experiencing any of these things, that you meet with a healthcare provider or a specialist so we can work through what exactly is causing the symptoms and how to really move this forward in terms of the treatments. BPH can actually coexist with prostate cancer too. And PSA levels, which is the blood test, the prostate-specific antigen, that is a screening test for prostate cancer. I will typically say is PSA is prostate-specific, but not cancer-specific. So PSA levels alone are not indicative of prostate cancer or BPH. They are a tip-off to let us know if we should investigate things further. As long as we have an explanation for what causes your elevated PSA levels, that's the most important thing, so we have a directed treatment. So like these diagrams side by side, the image towards screen left here is really what a normal sized prostate gland looks like within the lower urinary tract anatomy of a male. So we have our bladder at the top part of the diagram. That is the reservoir for urine. And that will basically generate a squeeze or a pressure, pushing that urine out through the prostate gland that then travels through the urethra or the tube through the penis where those green arrows are indicated. In a situation where the prostate gland is not swollen, you will not typically get a backup of urine, and you will not typically have a lot of strain on the bladder. The urine should empty very easily across any prostate tissue. Conversely, the image on the screen right here is basically showing you what will happen as that prostate gland enlarges. So again, you have the bladder at the top part of the image, and then you have a much larger prostate gland here surrounding that urethra. It's compressing and making a very narrow channel where that urine is having a difficult time passing. This not only contributes to a buildup of urine in the bladder for some individuals, but in some situations may cause you to hold on to urine requiring catheters and have bothersome symptoms such as frequency or an inability to evacuate the urine. It can also cause a lot of strain on the bladder, and that stress or tense voiding pattern over time can actually cause negative damage or remodeling to the bladder, which may be permanent in some situations. It's also important to note that not all very large prostate glands cause true obstruction, nor is it the situation where small prostate glands are not obstructive. So really what we're looking at here is the tissue of the prostate gland impinging upon the urinary tract, whether you have a very big prostate or just a mildly enlarged prostate. So what are some of the symptoms of BPH? These can range most commonly from frequent urination, daytime, and most men experience this during the nighttime when the bladder is a bit more sluggish and having a difficult time emptying across that prostate gland. Some individuals, because of that tension on the bladder, develop a sudden urge to urinate where I have to drop what I'm doing and go to the bathroom. I'm not going to be able to hold it or I'll leak. Weak urinary flow or some dribbling after urination can be common. Most individuals become pressure-related voiders throughout their life, meaning that when their bladder is very full, they may generate a better stream just from the pressure of the volume of urine in the bladder. As we empty and as the bladder becomes less full, you will start to get less pressure, and then the urine will cut off or dribble at some points during the stream or towards the end. You may get a sensation of incomplete evacuation. I go to the bathroom and I have to go right back because I have not completely emptied. Some people have a hard time starting their flow. I wait around at the toilet bowl for several seconds to minutes in some situations to really start that stream. And then my stream may cut off in between intermittently until I'm finished urinating. And in severe situations, an individual can experience an inability to urinate, which is really a situation that is an emergency that would require a catheter. So BPH, it's very clear, can affect quality of life. And I typically will say if we're not holding on to any dangerous amounts of urine in the background, the reason to do something differently about your BPH or your enlargement would be to, one, preserve the health of the lower urinary tract, but also to help to reduce some of the symptoms that are impacting your quality of life or your symptomatic bother. So 95% of individuals in many of the studies that we have are very unhappy with the symptoms that they experience with moderate enlargement of their prostate gland and would not want to spend the rest of their life with those symptoms if possible. 51% of men feel that their BPH interferes with at least an aspect of normal living. Many people are affected during long car rides or when they're at work or even at home having to go to the bathroom very frequently, day and night. 49% of men experience some sexual related problems associated with their enlargement of the prostate gland or their lower urinary tract symptoms. And it's important to note that BPH does not just affect a man, but also the people around them. You know, partners and their quality of life, disrupted sleep and things like that can also be a factor here. So BPH is a very common issue. It affects about 50% of men over the age of 60 because the prostate gland continues to grow for most individuals throughout their life. It's stimulated typically by testosterone levels and other factors that cause it to grow slowly over time. And it affects about 90% of individuals over the age of 85. 14 million men in the US had lower urinary tract symptoms, and there may be some factors that can exacerbate or make worse the way that you urinate when you have an enlarged prostate, including truncal or abdominal obesity, higher body mass index, or lack of exercise, where that muscle is not as toned or able to cope with the outflow obstruction from the prostate. So, how do we diagnose an enlarged prostate gland? Well, typically there's a few different ways. If you meet with a urologist or a specialist in the office, we will oftentimes recommend an exam to get a general sense of how the prostate is shaped. Are there any irregularities along its contour? This is a finger exam from down below that takes several seconds to do. So that's the digital rectal examination. PSA is oftentimes part of our screening, not only for prostate cancer, but general kind of prostate wellness, to give us an idea where those levels sit and what an explanation for any enlargement or PSA elevations over time would be. And then there are some flow tests that we sometimes recommend to give us a little bit more functional information about how the bladder empties. So these are things that test the strength of the urinary stream, the peak urinary flow, Qmax, post-void volumes, which is basically a residual of urine after you've gone completely. How much urine's left over? Is that a safe or a more dangerous level? And then there are some more advanced tests, which basically non-invasively can look at the pressure and the flow on the bladder. These are things like urocuff or uroflow, and more comprehensive tests that involve bladder filling and emptying and look at the muscle tone and any irregularity in the bladder squeezing, such as urodynamics. Sometimes camera looks can also be helpful to look at the anatomy. It's also important to note, though, that we take into consideration certain self-reported symptoms. So we use a number of different scales in our office with our patients to really gauge how bothersome is your prostate-related symptoms. Are your signs and symptoms most related with obstruction or something else like irritative change within the bladder? So there's a number of these different symptom scores, everything from the International Prostate Symptom Score to the American Urologic Symptom Index, and the quality of life score. How bothersome is this on a scale of 1 to 5 or 6? So we'll go into more detail now about different treatment options for your enlargement of your prostate. So it's very important, again, if you're experiencing any of these symptoms, I always say that information is power, and it will help dramatically to meet with a professional who can help to move this along for you. There are many, many ways and many different strategies to progress your symptoms, but you have to be able to engage with someone who can help you along and use their expertise. We want to partner with you. We want to move your symptoms forward and help you to live a healthier lifestyle. So as we go through the different treatment options, a very broad overview, there are behavioral modifications. These are things like changing your diet or fluid status. There are some ways to strengthen some of the muscles or retrain the bladder. And there are ways to kind of track how we're progressing in terms of our urination. Then we have different first-line therapies. These are things that don't require general anesthesia or would be kind of less invasive options for treating. These are everything from medications to help to address the prostate gland to steam therapy of the prostate, which is Rezūm Water Vapor Therapy, or permanent implants such as UroLift. There are also surgical procedural options that range from green light laser therapy to standard or traditional shaving of the prostate, TURP, aquablation, prostatectomy, which is a more incision-based surgery to address the prostate gland and its enlargement. So it's also important to note that although there are a number of things advertised from a dietary supplement standpoint, there haven't been robust reported studies to really demonstrate long-term efficacy or help in terms of using some of these supplements. This includes popular supplements, including saw palmetto or Urtica dioica. So one approach, then we'll go from least invasive to kind of more procedural options as we're talking through these therapies, is watchful waiting. This involves lifestyle modification, the way that we adjust the fluids that we drink or the behaviors that we do to help to manage our symptoms. This is really kind of most appropriate for people with very mild or very minimally bothersome symptoms who don't have any dangerous residuals related to their enlargement of the prostate. Many people will try to adjust fluid intake around the times that they do not want to urinate frequently. This may include prior to engagements or activities, as well as cutting fluid intake prior to going to bed at night when urination symptoms tend to be most bothersome for a lot of men. And then also being aware of different medications that can slow down bladder emptying. These include some pain medications, things like Benadryl or sleep aids, as well as antihistamines or anti-allergy medications. We can go over a comprehensive list of these things with questions as well. And then benefits of this type of approach is that it doesn't really require any type of anesthesia or implantation or major intervention, but it may not be appropriate for everyone. It's important to really track how you're doing on this approach if you're going this way and partner with your specialist. Medication options include medications such as alpha blockers. These are popular medications like tamsulosin, Flomax, uritraxol, alfuzosin, silodosin, or Rapaflo. What these medications do, think about that prostate gland like a ball that surrounds the tube. It relaxes the prostate gland, creates a more free and wide channel where the urination will flow. Many of these medications, though, have side effects. And so they are light blood pressure medications. So some individuals experience lightheadedness, dizziness, or in severe situations, fainting with these medications. They can cause some lethargy or tiredness. And some of these medications may cause a decrease in the amount of ejaculate that you're able to produce. There may be interactions with other medications, including blood pressure medications. So I will typically say that medications, when you start them, are meant to be maintenance medications. If you stop these medications, typically the symptoms will return in some situations pretty quickly. So, most of these medications, if you're going that route, are meant to be longer standing options. 5-alpha reductase inhibitors are a second class of popular medications that we use to treat enlargement of the prostate. These actually mildly shrink or inhibit the growth of the prostate gland further. It basically works on one of the testosterone mechanisms that cause the prostate gland to grow. It stops regular testosterone from converting to a variant of that called dihydrotestosterone or DHT, which is the primary growth signal for the prostate. Some individuals, although these medications act very slowly over the course of several weeks to months, may see a shrinkage of their prostate gland that will meaningfully reduce the swelling or blockage of their prostate gland on their urinary flow. But many of these medications also have side effects like erectile dysfunction, decreased libido, and ejaculation issues, in some situations, breast tenderness. Rezūm Water Therapy or water vapor therapy is an outpatient, straightforward intervention for the prostate enlargement for many men where medications are just not acceptable or you're not reaching your desired outcomes with medication therapy. This involves using a natural water vapor to shrink the prostate tissue down to a more normal size that will cause less outflow obstruction. The analogy I use here typically is think about the prostate gland like a grape. We are basically shrinking the prostate gland to a raisin. And in many situations, this does not require general anesthesia, can be done comfortably in an office setting. It does require a degree of medications afterwards to help with urgency or frequency in urination. In rare circumstances, would this be associated with any decreased ejaculate volume, 1 to up to 5% in some of the studies, and a far less effect than some of the medications and some of the other options for treatments of the prostate gland that involve procedures. Irritation with urination, frequency, burning sensation, urgency, and some blood in the urine and the semen can be expected afterwards for several weeks. There's a 4.4% retreatment rate through 5 years by our data set, so a very good option in selected patients with their enlarged prostates. This is an image or a diagram of a before and after where that prostate gland is bulky, impinging upon that urethra, and then we shrink that prostate gland, create a wider channel. I'll play briefly this video, just the first onset, to show you what this looks like. It's done through a camera-based approach. There are no incisions to do this, all done through the urethra. A small needle that injects steam into the prostate in a very focused fashion is applied, and we target all that tissue that really is most obstructive to help to shrink that prostate gland in a targeted fashion.
Rezūm Water Vapor Therapy is a non-surgical treatment for BPH. Rezūm uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue.
So that's a diagram of essentially what we're doing to the inside of the prostate with a Rezūm therapy. Again, a very good and straightforward option for many patients with enlargement of their prostate. All right. So overall, 97% of individuals in the studies that we have and survey studies would recommend Rezūm therapy, having undergone that. We'll show a quick testimonial from a patient who's gotten Rezūm Water Vapor Therapy.
Found out that I had BPH, my symptoms were a slow strain, and I would wake up frequently in the middle of the night. I first heard of this when I was researching prostate and therapy. And so was one of them. When I researched Rezūm, it's the latest and greatest technology, and I want to be part of the technology. I think the technology is good. My experience with the Rezūm procedure, very good. After the procedure, I was a little worn, a little tired. And the next day I felt fairly good, was able to get up and get around.
Since Joe's Rezūm procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezūm treatment has made a very big difference in our life.
So next we'll go into some other options for procedural interventions for the prostate. There's the prostatic urethral lift or urolift. This is also potentially an outpatient procedure done under local or general sedation anesthesia, where we apply permanent implants to move that prostate to the side and create a wider channel where the urine will pass. This is a situation where basically like the analogy I use is think about curtains in front of a stage. When we apply these implants, we open the curtains, create a wider opening where the urine is going to flow. There has been emerging data that there's a higher retreatment rate with these types of implants, about 13.6% through 5 years in some of the more recent studies. But in selected patients with primarily enlargement from the sides of their prostate, this can be a very effective therapy. It can cause some painful and frequent urination, blood in the urine, or irritation, which you'll see with a lot of these types of therapies, as well as an urgent desire to urinate. In very rare circumstances would this ever contribute to stone formation in the urinary tract or very painful ejaculation that's long lasting. This also has a very low effect on ejaculate volumes. Green light laser therapy is another intervention that is done through an endoscopic or camera-based approach. This is sometimes an outpatient procedure where we use a laser to vaporize that prostate tissue. The data is very good, 4.8% retreatment rate through 5 years. This may require sedation to do this procedure. Again, irritation with urination, rare circumstances of urinary tract infection or difficulty emptying the bladder after the procedure occur. You will have some hematuria or blood in the urine, and in rare circumstances will this ever cause any scar tissue or narrowing as that prostate tissue is healing after the procedure. Here's a video of green light laser therapy, which will show again through the diagram. We target the enlarged prostate tissue with the green light laser, and this will allow us to basically create a wider channel through a vaporized prostate gland. So in doing so, we create a larger channel where that urine will flow more freely. We'll move on to some of the other more advanced therapy options for patients with enlarged prostate gland. So transurethral resection of the prostate is the traditional classic gold standard for the way that we treat prostate enlargement. This procedure has been around in some degree for many decades. And although the technology has advanced, it's essentially using a heated loop to core out or shave away the obstructive tissue of the prostate gland. Think about this like coring out an apple to create a wide channel through. This does apply a heat energy throughout the prostate tissue, which can lead to a bit more irritation with urination afterwards. I typically will do these procedures as an outpatient surgery with a catheter for 1 to 3 days, depending on a patient's procedure voiding state. Blood in the urine can be expected along with irritation and in some rare circumstances, leakage of urine, typically less than 1% in prostate glands that have not required treatment before. Scarring and narrowing can occur though, as that heat energy shrinks that prostate and shaves it away. You can sometimes get a bit of contracture along the prostate gland, although this is a rarer circumstance. And again, the retreatment rate, all comers here, is about 5.8% through 5 years. But remember, we're dealing with a bit more complex glands in these types of situations. So overall, these have durable long-term outcomes. Prostatectomy refers to an incision-based surgery for very large prostate glands. And this basically is done through a robotic approach, small incisions through the belly cavity to then cut into the prostate tissue and core the prostate obstructive tissue out while leaving the capsule in place. Think about this procedure as if you have an orange with a peel on the outside, taking the inside of that orange and coring it out and removing it while leaving the peel intact. Obviously, this is a bit more invasive, can lead to a higher likelihood of bleeding, in rare circumstances, blood transfusion. It will require hospitalization in many situations for 1 to several days. It can cause scarring or narrowing of the urethra or bladder neck narrowing. And then in some situations, can also cause urinary leakage or incontinence. There are temporarily implanted devices that now exist. These are baskets that basically cause, they're put in through a camera and they cause a compression of the prostate gland from the inside within the urethra. They basically shape or widen that anatomy. They stay in for about 5 to 7 days, and then the implant is removed through a camera. Doesn't require general anesthesia. It's a temporary implant, but retreatment rates are around 8.6% through 3 years. We have to very carefully select the type of prostate gland we're applying these implants to make sure that they would receive the maximum benefit. This would not be an ideal situation for very large or bulky prostate glands. And the commercial product here is iTind, but there are a number of different options from this standpoint. It can cause a little pressure and burning within the urethra, blood in the urine, pelvic pain, and some urgency to urinate. Aquablation therapy is a water vaporization of the prostate gland. The analogy I use here is think about the aqua beam as a power washer, and we are regulating that power washer very precisely with a robot to vaporize the prostate tissue to create a wide channel where that urine will flow. This does require a general anesthesia or a spinal anesthesia. In rare circumstances, when we do this as an outpatient procedure, typically an overnight stay in the hospital with some fluid to rinse out the bladder and the vaporized prostate tissue. This is one of the newer types of procedures, so some of the long-term data is still being worked out here. However, this has become a very good option for patients with large-sized prostate glands or obstruction from a few different areas of their prostate, including median lobes. Overall, it has a low risk of ejaculatory dysfunction, about 5 to 8%, but still a bit higher than some of the options like Rezūm, or an implant surgery like UroLift, where we're not really disrupting much of the tissue. Overall, a very low risk of any injury to the tissue around, because this is a tight robotic regulation. This tends to be a good option for a lot of patients too, considering treatment for their enlarged prostate. And then a procedure that we don't do a whole lot of anymore, but there are some options for having this type of treatment, is a transurethral needle ablation of the prostate, or TUNA. This involves needle punctures to create a high frequency of energy that basically goes through the prostate tissue and then ablates, or kind of shrinks or treats the prostate tissue in a targeted fashion. The problem with this type of therapy, and why it's really fallen out of favor, is there's been a higher and higher reported retreatment rate, about 23% through 5 years. There are more targeted, kind of better selective options in modern day. So in summary, I know this is a whirlwind tour of a lot of different therapies for prostate enlargement, but your options exist where we can watch the prostate and the way that you are urinating in select situations, as long as we are not seeing any high pressure on the bladder over time, and our residuals are staying low, and our symptoms are being reasonably managed. Many individuals, however, will find that their prostate glands grow with them over time and really continue to compress that urethra, so it becomes more and more bothersome. I will oftentimes say, if you live long enough, you will probably have an issue related to your prostate, either a prostate cancer growth or an enlargement of the prostate. It's identifying individuals who really would benefit from early intervention here to set you up for long-term success. Medication therapy, Rezūm Water Vapor Therapy are great options. There are implant surgeries that are less invasive, and then other options for more advanced or larger prostate tissues, including aquablation, green light laser therapy, TURP, prostatectomy, and in some situations, temporary implants of the prostate. So overall, I will typically end my lectures by saying it is very important for an individual who is dealing with any type of medical condition to work with your healthcare professional, to have us help you and partner with you to move along and help to change and impact positively the issues that you're having. In these types of situations, it's very important to be able to talk about the issues that are affecting you and see how we can best treat and move things along from that standpoint. There are a variety of different options. And when someone comes and meets with me as one of our specialists, we really try to tailor those therapy options to what is most bothersome to you and what your goals and outcomes are desired to be. So if something is bothering you, speak up. Make an appointment, meet with a specialist, and see how we can move it forward for you. So now we'll have some time for some questions.